lot of patients are unaware that home care even exists. They find out they can get therapy coming to the home, a home health aide coming to the home, and they just had no idea until they see the whole range of services that are showing up at their doorstep.
Sometimes we get calls from family members who've heard about our services and don't know where to turn. So we talk with them on the phone. We try to see what their needs are.
A lot of times you meet people who are pretty independent, who just need a small amount of support.
Like grocery shopping or cooking or getting to the post office or the bank.
We see a lot of patients who have diabetes, a lot of people who have chronic conditions like arthritis.
There are other patients who have a higher need, who are really very ill.
From a premature infant to a child who is physically disabled, to children who are on chemotherapy with cancer.
And that's when VNA Home Care would have to step in to provide all the support they need to stay in their homes.
Occupational therapy, home health aid service, nutrition, medical social work, the long-term care program.
Or maybe they need a nurse or physical therapy.
We'd utilize anything we needed to keep them home and keep them safe.
We can come in with all these services and make people's lives better. We can actually change people's lives with just a phone call.
There's a lot of people out there that don't realize the services that we provide. And if they could just make that one phone call, we would make a big difference.
Calling 477-HOME is the first step. All the care you need, where you want it most, at home. VNA Home Care.
At VNA Home Care, we have a team approach. We use nurses and therapists.
When you get care in your home, this is something that we will be able to tailor-make for you, and we can bring in all sorts of different disciplines to get in there and make sure that you get well as fast as you can.
We work together to provide the care for our clients in the home setting.
You know, it's a team effort between me and the patient and the family and any caregivers that are involved.
With home care, we have the chance to sit with patients to begin building a relationship. We have the extra time to sit there to get to know them as a person, as a patient.
We have the luxury of being able to sit and talk with them, and that's usually quite therapeutic.
When I treat a patient, I treat him like it was a close family member, a close friend, the way that I would want to be treated if I was in their place.
I love being able to take care of folks and make sure that they're getting well again. It's the kind of service that I would want to provide for my own family, and this is exactly what I do for these patients.
Some patients I have for years, some I've had since before I had my children.
We become an extension of the family. We've been in there for 17, 20 years. We become part of that family.
We don't like to try to send different people in. We try to be as consistent with all the services that we provide.
It's rewarding working with a great team of people who help patients maintain their independence and their freedom in their homes.
Because consistency gets results.
Calling 477-HOME is the first step. All the care you need, where you want it most, at home. VNA Home Care.
When somebody calls VNA Home Care, we sort out what their problems are. We start to plan our goals together, the patient, the family, and the nurse. That's what's really special about home care. We're focused on what that patient needs to stay in the home. Making that one simple phone call can make all the difference.
Calling 477-HOME is the first step. All the care you need, where you want it most, at home. VNA Home Care.
In my experience, most people prefer to stay in their homes versus going into a nursing facility.
They don't want to be in the hospital, they want to be at home.
You've gotten your own furniture, you've got your friends and your family, and everything to make it comfortable.
The services that we provide at home make a huge difference in the patient being able to stay where they want to stay, where they're happy, where they're safe.
It's very rewarding when you're able to give somebody a resource that is able to restore their independence.
We're able to bring in all these services, take care of the patients, whatever their problems are, and I see the results. I see them getting better every day, and I just love seeing that.
When you can go into somebody's home and make it so that they can stay there, so they don't have to leave their house that they've lived in for 40, 50, 60 years, that's what brings them joy, so that's what makes me happy.
I feel like I really make a difference in a lot of people's lives. I've helped them find services that can keep them independent, keep them in their own home.
It feels good to provide services in the home, to meet people where they're at in their time of need, and be able to set them up with the services that can keep them independent and provide it in a safe and effective manner.
We do have a lot to offer, and if we can make their life a little bit easier, then it's well worth it.
Calling 477-HOME is the first step. All the care you need where you want it most. At home. VNA Home Care.
Kaylee just celebrated her 16th birthday right here at home. She has round-the-clock care, and VNA comes in and does the dressing changes and the lab work weekly. Without them, we would not be in the home. And for Kaylee, it's better and safer for her to be at home. It's where she belongs. With the help of VNA Home Care, this is where she's going to stay.
Calling 477-HOME is the first step. All the care you need where you want it most. At home. VNA Home Care.